Hi, I'm Insiyyah Patanwala, and I'm the director of the Pelvic Pain Center at the University of Chicago. Endometriosis can take years and years to diagnose for many women, and the reason for that is that it doesn't always show up on imaging. We have a augmented pelvic ultrasound where we more closely follow a protocol to detect endometriosis, especially endometriosis that's living behind your uterus. But even that is still not 100%. For a lot of women, I will order an MRI if I strongly suspect endometriosis. While MRI is usually better than ultrasound, once again, it's still not 100%. The only way that we can know for sure is by doing a diagnostic surgery where we take a camera and put it inside the abdomen and take a look inside. So there isn't just one treatment for endometriosis. Really, every woman should have an individualized plan based on her goals. If you are trying to get pregnant, your treatment might be different than someone whose main goal is pain reduction. Really, there are kind of some main categories of how we treat endometriosis. First line is usually hormonal management, which means that we try to either bring your hormones into a steady state or suppress your ovaries to try to decrease your endometriosis pain and disease. Then we talk a little bit more about pain management with nonsteroidal anti-inflammatory medications such as high-dose ibuprofen or naproxen, or we talk about surgery. And surgery can be a small surgery or it could be a large surgery depending on how much endometriosis you have. So typically we usually like to start with hormonal suppression because it usually has less risk than an invasive surgery. The good news is that you don't have to go through surgery in order to be treated for endometriosis. We can treat you as if you have endometriosis, whether we know for sure or not, because typically the first line treatment is hormonal management. One answer isn't necessarily the right answer for everyone. And so you need to talk about your goals with your doctor and ask them what's the best next step for you.